Have we become incredibly good at counting accidents, but relatively poor at measuring the preconditions of safe and reliable work? And are our safety indicators leading us astray? Let's find out. First, welcome to Safe As. I'm Dr. Ben Hutchinson. Check out safetyinsights.org for more research. Now, today's study is from Oswald et al., 2018, titled The Use and Abuse of Safety Indicators in Construction, published in Engineering, Construction and Architectural Management. They explore systemic flaws in how construction and safety is measured. Drawing on two datasets, 32 semi-structured interviews with industry professionals, and a multi-level safety climate survey conducted across 12 construction sites. The study begins by contextualising why traditional lagging indicators like lost time injuries, LTIs, are fundamentally limited. Prior research establishes three primary limitations. First, the reverse relationship. Indicators intended to be leading often behave like lagging ones. For example, projects with high volumes of safety reporting may also experience higher injury rates, either because the work is inherently higher risk or because of a more transparent safety climate that emphasises reporting more. Second, measuring unsafety rather than safety. Most commonly used indicators capture the absence of failure rather than the presence of safety. We count how many people were hurt, but rarely measure the system's capacity to succeed to effectively control risks. Third, the rearview mirror effect. Because lagging indicators only capture events that have already occurred, they offer very limited predictive value for proactive intervention. This makes it difficult for managers to act before a future catastrophe occurs. So, what did they find in this study? The interviews revealed that industry leaders remain obsessed with lagging indicators, frequently requesting them as golden numbers of performance. However, this obsession leads to widespread manipulation. When indicators are coupled with financial bonuses or penalties, the resulting data often becomes nonsense. Participants admitted to manipulating statistics. For example, moving an injured worker into a light-duty office role specifically to avoid recording a lost time injury. The study notes that financial penalties imposed on contractors further encourage manipulation of statistics to maintain performance. A core finding is that indicators are often selected for their ease of measurement rather than for their usefulness. Companies focus on what is clearly measurable, such as the number of site walks or the toolbox talks completed. However, the study suggests that the most suitable indicators may be harder to gather or measure, and for this reason may ultimately be ignored. This creates a facade of safety, while deeper drivers of performance remain unexamined. Even leading indicators, long promoted as the solution to lagging metrics, are susceptible to abuse. The study identifies plastic gestures, safety activities performed solely to satisfy a metric. One example involved office-based staff, such as accountants, being encouraged to conduct site safety walks. While this increased the recorded number of safety activities, these individuals often lack the expertise to identify hazards and, in some cases, increase risk simply by being present in dangerous areas. Leading indicators also frequently focus on activities contractors would undertake anyway, the things they were going to do, resulting in guaranteed success, on paper at least, without any meaningful improvement in their hazard management. By counting actions rather than evaluating their effectiveness, organisations omit measures that assess the real impact of safety initiatives or their systems. The research found that the vast majority of indicators focused on immediate physical safety, while largely neglecting worker health hazards such as dust exposure, noise, and mental health. The authors argue that commonly used health and safety indicators are subject to manipulation and misinterpretation. Because these indicators fail to reflect the full range of factors affecting safety, organisations often respond to spikes in lagging indicators with a superficial shotgun approach, rolling out multiple generic action items. Such responses rarely address deeper systemic weaknesses. The study concludes that an exclusive focus on negative, lagging indicators is frustrating for contractors and probably everyone else because it provides little insight into why poor performance occurred. And there's also the risk of rewarding largely random outcomes. If you see the work from the Construction Safety Research Alliance. So, what can we make of these findings? Well, to move forward, the authors argue that the industry must incorporate indicators that capture the complex cultural factors and socio-technical factors underpinning safety performance across organizational, project, work group levels, rather than relying solely on easily quantified metrics. Ultimately, the study doesn't argue for abandoning safety indicators. Instead, it warns against treating them as precise or objective measures of safety, whatever that is. Indicators are proxies, imperfect signals that must be interpreted with humility and contextual understanding. When organizations prioritize numbers over meaning, measurement itself becomes a source of risk. A more mature approach to safety requires shifting attention from counting failures or activities towards understanding how work succeeds. The inputs, how capacity for safe performance is created, the resources, designs, climates, leadership, systems, risk control create safe and efficient work. In all, it's about how people create safety and sometimes unsafety. Well, that's it on Safe As. Please like and subscribe and check out safetyinsights.org for more research. If you want to support the channel, then links are in the show notes.